My name is Christina Holmes, and I am a breast cancer patient here in Trumbull, Connecticut. I have a wonderful husband and two beautiful teenage sons who I'm extremely proud of. And I found out I had breast cancer in January of 2020. Prior to that moment, I was living an extremely full and busy, active life, being a Pampered Chef consultant for fun, because, the kitchen is the heart of the home, and also running our family business, which was a thriving ballet studio here in Norwalk, Connecticut. So everything was at full pace. And at the end of December 2020, I did notice a lump in my right breast, and got it investigated. And that's when we found out, just after the first of the year in 2021, that I had breast cancer. So when we got the diagnosis, we pretty much knew. Actually, I could tell by looking at my breast, and my husband could tell by looking at the breast, that there were definite changes. And these were things that happened overnight for me. There were times the changes seemed to happen overnight for me. I didn't have any indication, or at least I thought. I mean, you're stressed out and you go at a very forced march kind of pace through life. I get up, I do my things, I go to sleep, I get up, I do my things, I go to sleep. And you don't, sometimes you get yourself into a mode where you're not really paying attention. You have that little ache or that little pain or that little twitch, and you just keep going. I should have listened to my body more. Looking back, I do feel that it was trying to tell me something. No matter, the cancer was there. I was not at a high risk for breast cancer. There's no history of any cancer in my family except possibly one great grandparent who had stomach cancer. So statistically, I'm at average risk. And here I was with breast cancer. We do communicate very openly and honestly with our teenage sons about everything. It's kind of sweet, but when they were very young in preschool, they had a time of day called circle time. And when I went to preschool, a parent observation day, I thought, wow, this is great. And I had circle time as part of our bedtime ritual with the kids. So we still call it circle time. And we came together and we told them, and they knew something was wrong. They saw me putting a heating pad on my breast. And they're like, what's the matter with you? So I lied to them and I said, I pulled a muscle, leave me alone. But as soon as we knew for sure what was happening, there was no way we weren't going to tell them right away. And they had a lot of questions and they were nervous naturally, but they took the news really well. And I told them, you can ask me anything. I will answer you honestly. Just, let's have it out. And that night we surprised my parents and went over for dinner, and they took the news extremely well. And I have to tell you, it was really a relief to be surrounded by family who was able to be brave with me in that moment. The tears didn't come until later, and now they come whenever they want. But, it's just part of the journey. I learned how to do breast exams from my gynecologist, who I started seeing when I was about 18, like average, every other woman. And she taught me how to do breast exams, did the breast exams on myself, usually in the shower, because it's just more convenient. It became part of my shower routine. And they would make sure every year when I went for my annual checkup that I was doing my breast exams. After I had my children, actually, it was about a year and a half after I finished nursing my youngest. So I figured I was totally dried up. I was in the middle of the supermarket. Actually, I was at the checkout aisle in the supermarket, and a newborn baby, like 2 weeks old, fresh newborn baby, so tiny and precious, starts wailing, and my breasts let down. And I thought I was done. Like, I thought I was dried up. I called my gynecologist immediately, like from the car before I drove home, and said, I need an appointment. My breasts just let down. Who do you call when your breasts let down? A year and a half after you finish nursing, what department do you call for your breasts, right? So I call the gynecologist, and he says, well, sure, let's send you for an ultrasound and a mammogram and get you checked. But I don't think it's unusual. We're not worried. And so I went and I got checked. And that was my first mammogram. And I was 34 when that happened. And my gynecologist said to me, I see nothing wrong. Everything looks healthy and wonderful at 34, but you'll always have to have an ultrasound with your mammogram because you have fibrous breasts. And you have to go every year. And I balked and thought, well, some women never dry up. I fall into that category. That's hysterical. And I would have made a great wet nurse in the Middle Ages, but not today. So, you move on. And here I am now, 46, after having had annual mammogram and ultrasound since age 34, regular breast exams. And I'm telling you, this lump came out of nowhere. It just was there. And I found it doing a regular breast exam. I mean, my breast was a little sore for quite a while. When I had my period, my armpit would swell up, like it would feel swollen, and there was a tumor in my lymph node. So when I brought that initially to my gynecologist, they said, well, that's normal because your breast tissue sometimes expands when your hormones shift. It's a normal thing. Right? I'm sure many women have that sensation, like you can't put your arms down when you have your period because, the side boob is swollen. Well, and for me, it would go away completely. But in recent months to the diagnosis, I did notice that I wasn't getting my period anymore. I'm pretty sure I was in premenopause, but that swelling was happening and not going away as much. So even the axillary lymph node tumor was hidden and seemed to not cause any trouble. Now, COVID shut down, and I'm sure this was the case in many parts of the country. COVID shut down my location for mammogram and ultrasound, unfortunately, and they canceled my appointment like so many other women. But I was on schedule still. I wasn't completely off. I was less than 2 years from my last mammogram when I had this one, which I had because I found the lump. They weren't able to schedule me until later, but they bumped me up to see her immediately status, and everything moved very quickly from the moment of diagnosis into a lot of other testing, and my care plan was to do chemo, surgery, radiation, and a bunch of other stuff. So we got right into it. We jumped right in as quickly as possible. I was diagnosed with stage 2. He couldn't pinpoint A or B, but it was stage 2 invasive ductal carcinoma, both estrogen and progesterone positive, HER2 negative, and also with metastatic breast cancer in the axillary lymph node. So the first part of the journey was with advanced radiology and the breast surgeon doing biopsy to get to that point where they could give me the stage 2 estrogen and progesterone positive, and all of the details. And we moved from there very quickly to the oncologist, who set me up with the plan. And I also was assigned a social worker, which was extremely helpful. A caseworker, social worker, the various hospitals will give them various titles, but this woman has held my hand and laughed with me and cried with me throughout this journey. And she's been wonderful. And my oncologist, the whole team has been wonderful. It's important to love your doctors. And that's a thing that I was worried about going in, because as I got the news from advanced radiology that my scans didn't look good and I needed a biopsy, they just referred me to the breast surgeon. And I questioned them and said, what if I don't like this person? And they said to me, well, it's fine. They got me an appointment right away. I have to tell you that from the beginning, the gentleman I met, the doctors, said words to me like, I'm going to shepherd you through this. We are going to restore you completely to health. And I have faith in them that they can do that with the technology that they have. They've done absolutely everything. So we started with chemotherapy, thinking, of course, that it's a great way to begin because we'll know how my body responds to it and to this particular chemotherapy drug. And it'll help inform treatment when we get into the last part of the phase, which is where I am now. And so we did 8 rounds of ACT, and we did it over 16 weeks. Then I got to rest. And during that rest period, I had a bunch of additional scans, just recheck just about everything, see how the chemo affected the tumors. And we moved into surgery at that point. So my diagnosis was January 12th. We began chemo on February 6th or something like that. And we had a break from May until July 6th when I had surgery. Based on how my cancer responded to the chemo and what they could see in the scans, everybody felt. In fact, they even presented my case to the tumor board, and it was unanimous that I would be successful with a partial mastectomy and axillary lymph node dissection on the right side, which is the cancer side. And then on the left side, we were going to have oncoplastic reconstruction so that the left side matches the right side. Symmetry. I wanted symmetry. And so that's what we went in for on July 6th. And the surgery was a success. It was beautiful. It was well done. And a week after, I got a phone call from the breast surgeon saying that he didn't get clean margins. So we have to go back into the right breast and take more tissue. No big deal. We left the right breast a little bit on the larger side because of radiation. And radiation will change that tissue and change the shape of the breast. So we left it a little bit larger so that it could take radiation and it would still match. And either way, the plastic surgeon was going to fix things up. But it was still my tissue. So, okay, fine. We go in for the second surgery. Again, tumor board, everybody agrees. Piece of cake. We'll go in, take it out. And a week after that surgery, which was July, we're in July, end of July at this point. They came back a week later and they still had cancer in there. So at that point, now I'm 3 surgeries in. I really only wanted one. You can imagine how I was feeling. And this time it was very simple, cut and dry. Bilateral mastectomy. The whole left breast should come off as a prophylactic measure. Why did this happen? Why did they not get it all? You can't see it, smell it, hear it, touch it. It doesn't sneak up on you and tap you on the shoulder. It's not visible to the human eye. Or else, yes, it would have been very simple. There's the tumor. I can see it. Let's cut it out. But it's not like that with breast cancer. I'm sure there are other cancers that are very similar. And I absolutely, with my whole heart, as much, and I love my doctors. I love my team. I love all of the wonderful nurses and caregivers. I really, truly wish with all my heart that the CubTech technology was in the OR with me the first time. I mean, if I had one thing, if I had something to say to other women that are going through this, I can tell you it really feels like an endless journey. And the mental game, the mental and emotional stamina that you need is unlimited. And the best thing you can do for yourself is to surround yourself with positive people. People who don't bring you down, people who don't make you feel bad about yourself, people who you can laugh with. Find something to laugh about because the journey is long and it's exhausting. It doesn't have to be if you can laugh. I mean, The sun still comes out every day, right? It can't rain all the time. Yes, yes. You are walking beside your cancer every day, every minute of every day. But you also have your family and your friends and your pets, and dinner won't cook itself. So it's okay to be distracted by positive things. And don't let your mind wander too much to the negative. There's no point. This is the ultimate, it is what it is. Sit down beside the river and just watch it flow for a while and be at peace with it. Hold hands with it and be a strong advocate for yourself. So, as it turns out, I have a cousin who is 82 years old. She's my mother's first cousin, and she was diagnosed with stage 1 or stage 0. I can't remember, but breast cancer. She had a lumpectomy 3 days before I had my bilateral mastectomy, and they got it all for her, and she's done. But I found it really interesting that no breast cancer popped up in my family at all until I had it, and then she was scared to death. And we sat together and we held hands and we laughed. Um, but she was one surgery and done. In fact, my doctor said to me that they have a case like mine once or twice a year, and it's okay to be special, but we don't all have to be special. It would be nice to have one and done. And as much as I know I'll be happy with the result in the end because I want to live and I want to thrive and I want to be happy in my body, and my doctors all want that for me too. I I really would have been better off with only one surgery. I happen to also have the factor V Leiden genetic mutation for blood clots. So the more surgeries I have, the more at risk I am for a blood clot and other complications. Less surgery is better, and CubTech has the answer. This should be in the operating room with every breast cancer patient in the world.